Hey there. If you or someone you love has diabetes and is getting ready for surgery, you know it can feel like you're juggling a whole other set of worries. Well, today, we're going to pull back the curtain on exactly how diabetes is managed before, during, and after a procedure to make sure everything goes as smoothly as possible. Let's dive in.
So let's start with the big question. Why is surgery, which is already stressful for anyone, such a unique challenge when you have diabetes? Well, the answer actually goes way back to our body's ancient survival instincts and how they can seriously backfire in a modern operating room.
And I mean, just look at these numbers. For a typical general surgery, up to 40% of patients with diabetes can end up with high blood sugar. But for something like cardiac surgery, that number shoots up to a whopping 90%. This isn't just some small side note, it's a major hurdle that the medical team has to be ready for.
Okay, so to make sense of all this, here's our game plan. First, we'll cover what we're calling surgery's hidden stress test. Then, we'll walk through what happens before the operation, inside the OR, and during recovery. We'll also talk about the biggest risks to watch out for, and we'll wrap up by looking at the all-star team of people keeping you safe.
All right, first up, surgery's hidden stress test. You see, it doesn't matter if it's a huge operation or a minor procedure, your body sees it as a threat, and it immediately flips the switch on its fight or flight response. And for someone with diabetes, this ancient alarm system can basically create a perfect storm inside your body. And that storm has a name: stress hyperglycemia. Here's what's going on. Your body, thinking it needs to fight or run, releases a ton of stress hormones like cortisol. These hormones do two things. They dump a bunch of sugar into your bloodstream for quick energy, and at the exact same time, they make your body resistant to insulin. So you've got way more sugar, and your main tool for dealing with it suddenly isn't working as well. And the fallout from that can be really serious. When your blood sugar is out of control, it can cause a whole cascade of problems. We're talking higher infection rates, wounds that heal much more slowly, longer stays in the hospital, and even a higher risk of more severe complications. This is exactly why getting blood sugar under control isn't just a nice to have, it's absolutely critical. So what do we do about it? How do we prepare for this? That brings us right to our second section, the preparation plan. Because honestly, the key to a smooth surgery starts way before you even pack your hospital bag. Think of this as your pre-surgery checklist. Step 1, and this is a big one, share everything about your diabetes history. The type you have, every medication you're on, any complications, everything. Step 2, get your A1C checked. This gives the team a snapshot of your blood sugar control over the last few months. And step 3, work with your doctor to make a crystal clear plan for adjusting your medications. And those adjustments are so important. This table kind of breaks down the why. For instance, a doctor will likely have you stop taking an SGLT2 inhibitor a day or two before surgery. Why? To avoid a serious condition called ketoacidosis. And others, like sulfonylureas, are often stopped on the day of surgery, simply to prevent your blood sugar from dropping too low while you're fasting. Every change has a very specific reason behind it. Now, if you're on insulin, the adjustments are just as crucial. The usual game plan is to reduce your long-acting or basal insulin dose by about 20 to 25% the night before or the morning of the surgery. And of course, since you won't be eating, you'll skip your mealtime insulin completely. The whole point of all this is to avoid one thing: low blood sugar or hypoglycemia during the procedure itself. Okay, let's move into the operating room. While you're under anesthesia, you can rest easy knowing there's a whole team whose job is to actively manage your blood sugar minute by minute. So while the surgery is happening, your team is checking your blood glucose levels constantly, usually every hour or two. For longer surgeries, they'll often use an IV insulin drip. This is amazing because it lets them make tiny, real-time adjustments to keep your levels right in that target zone. It's an incredibly controlled and precise process. All right, surgery's done. We're now in the recovery phase. The big focus now is on adjusting your diabetes management as your body starts to heal and, hopefully, as you start eating again. So in the hospital, you're probably going to hear about 3 different kinds of insulin. Let's quickly break them down. Basal insulin is your background 24/7 dose that your body needs even when you're not eating. Nutritional insulin is what you get right before a meal to cover the carbs you're about to eat. And correctional insulin, well, that's like a little top-up dose they use to fix a blood sugar reading that's crept up too high. And your insulin plan changes depending on one simple thing: whether or not you're eating. So if you're not eating yet, your plan is simple. It's just basal plus correctional insulin. But once you start eating meals again, they add that nutritional insulin back into the mix. It's a really smart approach that adapts right along with you as you recover.
Now, let's talk about the single biggest risk in all of this. Because while the whole team is focused on keeping high blood sugar down, the most dangerous immediate complication is actually the exact opposite.
And that risk is hypoglycemia, dangerously low blood sugar, typically anything below 70. Believe it or not, this is the most common and most dangerous side effect of diabetes treatment in the hospital. Avoiding this is priority number one. The entire plan is built around preventing this from happening.
And you don't have to take my word for it. This quote from our source really says it all. Iatrogenic hypoglycemia, that's a fancy term for low blood sugar caused by medical treatment, is the most dangerous adverse effect. This is precisely why your care team is so careful. They're performing a constant balancing act, controlling the highs while aggressively preventing the lows.
And there is a super important note here for anyone with type 1 diabetes. Because their body doesn't make any insulin, they need a continuous supply of that basal or background insulin, always, even when fasting. Without it, they're at risk for a very serious condition called diabetic ketoacidosis, or DKA. It's a non-negotiable part of their care plan.
So, with all these moving parts and all these risks, how does it all come together safely? Well, that brings us to our final section, your coordinated care team, because managing this is absolutely a team sport.
Just look at everyone involved here. You've got your surgeon, the anesthesiologists, hospital doctors, nurses, pharmacists, the list goes on. But you know what the secret ingredient is? It's not just their individual skills. It's communication. It's making sure everyone is on the same page, following the same plan, from the moment you walk in to the moment you go home.
So, if you take away just one thing from all this, let it be this. A safe surgery when you have diabetes all comes down to a well-structured plan that's tailored just for you and carried out by a team that is constantly talking to each other. It's all about preparation, careful management, and coordinated teamwork.
And that really leaves us with one final thought. As the patient, you are a vital member of that team. So as you get ready, the question you should be asking isn't just, am I ready for surgery, but is my care team ready for my diabetes? And being informed like this, well, that's the very first step to making sure the answer is a confident yes.